QSEN Module will discuss the use of visual thinking strategies in an obstetrics course. My name is Meg Mormon. I teach at Indiana University, and I teach an obstetrics course in the Bachelor of Science in Nursing. The objectives for this module are to explore ways that arts and humanities have been used in specialty courses in nursing education, and then specifically we're going to discuss what visual thinking strategies are and how they are used in this particular specialty course. We'll also discuss how using the arts can help nursing students and doctors communicate clearly and decrease hospital errors. Arts and humanities can be used in a variety of ways in nursing and medical education. This helps students to be creative and use their imagination to develop critical thinking, and it provides complex learning situations for students. Using arts and humanities, students can be introspective and reflect on their learning, and this helps them to develop communication skills and enhance their professional growth. Humanities also help to develop creativity, and it helps students to express themselves more effectively. In using humanities with students, students are able to interact with other disciplines, for instance, nursing and medical students, which we'll talk about in a little while. There are a variety of ways that the arts and humanities have been used in nursing education. One particular course allowed students to express their views of what nursing meant to them by either painting or doing a sculpture, and students were allowed to creatively express what the art of nursing was for them. Another course used pictures of illnesses that were diseases that students wouldn't normally get to see in their clinical situation. Students used this work of art to discuss the disease and talk about its symptoms and how it might affect family members. This provided students another way to learn about a disease state without going to the hospital and provided them with a clinical situation they would not have normally gotten in their clinical rotation. A psychiatric course used pictures of mothers and babies or the death of a child to develop empathy in students and help students to explore that through reflection. Poetry and literature is also another way to use the arts and humanities and provides learning situations for students, again, to provide a sense of reflection and to help them use creativity and imagination in their nursing care. So let's talk about some examples, and the example we're specifically going to talk about today with this module is the use of visual thinking strategies in nursing education. Visual thinking strategies was developed by Abigail Howson, who was a cognitive psychologist, and Philip Yenowin, who's an art educator. The technique was developed for kindergarten through 12th graders, and it was a way for them to study aesthetic meaning and development in these students. Group discussions centered around a work of art to help students put into words what they were seeing and use visual evidence to back up their beliefs. These experiences usually take place in an art museum with a facilitator who's trained in VTS. So the students meet at the art museum and they go up to a work of art that's pre-selected by the facilitator, and the students are asked by the facilitator what's going on in this picture. All students are allowed to give their interpretation of the work of art, and when the facilitator asks questions such as "tell me what makes you say that" or "tell me more," this requires students to dig deeper and validate their interpretations. All interpretations are valued. There's no one correct answer. This allows students to explore several possibilities for understanding and meaning in the same piece at the same time. So they hold all of these possibilities at once, with no one right answer. Each student's interpretation is acknowledged and validated by the group. Initially, Howson and Yenowin thought that the students would improve their ability to communicate and develop aesthetic meaning-making. But as they did this study, it was a 5-year perspective study, they found that students who underwent multiple experience with visual thinking strategies improved their standardized achievement scores from 54 to 88%. So it does have an effect on critical thinking. So let's look at some examples of visual thinking strategies. On the next slide, you'll actually hear a recording, and this was done at the Indianapolis Museum of Art with medical and nursing students. And it was a taped session, and I will show you the work of art, and then you will hear the experience, and it's guided by a facilitator at the art museum, and she's the one who asks the questions, and then the students respond, and you'll hear a variety of responses from different students. And then at the end, we'll talk about what the technique was that the facilitator used and why we used this specific technique.
but other kinds of symbols too. And then you said it, so did you, it looks like a map. Did you say that maybe this represents some kind of geographic topographical map, like where it's showing from above, like the elevation of mountains and things like that. But plus this large sweeping line with someone on the road to me. Although that was, I mean, it's just another map on top of the map. Okay.
let's talk about the teaching methods used with visual thinking strategies. With this method of teaching, all students have the opportunity to participate, but they don't have to and they're not forced to. We encourage everyone to give their interpretation of the painting. The student receives positive affirmations for their contributions, and the facilitator will try to paraphrase back what the student said and make sure they understood the student correctly. This gives the student an opportunity to clarify if there was any misunderstanding. The students learn to value all the viewpoints of all the comments as a means for viewing the art for multiple meanings. So in other words, if someone says that looks like a cat and another student says that looks like a dog, all of those possibilities are considered and they're all discussed. The group may find that one has more relevance than the other, but there's no right or wrong. Teachers are encouraged to participate. So when we do this with medical and nursing students, we have one of the professors from the medical school and myself, and we actually participate with the students. We do not run the conversations. Those are guided by a trained facilitator in visual thinking strategies from the Art Museum. So we participate with the students, but our responses are no more right than the students' responses. And then the facilitator will continually point at the painting and make sure the group's focus is on that piece of art in front of them. And they guide them back to that painting and they remind them that all the evidence they need is in the painting. And they really push the student to look at the painting and glean what they need from the painting. And not so much what their own personal meaning is, but try to use the painting as a way to give visual evidence for what they're seeing. The images that are selected for visual thinking strategies are always selected by the facilitator from the Art Museum, not the instructors. These images are selected, and they're images that people will be able to interpret without any specialized knowledge. These students do not need to have an art history class before they come to this experience. They actually don't need any experience at all with art museums or art. And we encourage that because, again, there's no right answer. We're not going to talk about the technique used in the painting. We're talking about what the meaning has for each student. The work of art should be a work of art that has more than just an illustration. We tend to pick works of art, or the facilitator tends to pick works of art that maybe are a little more abstract. Students think we're going to go look at pictures of mothers and babies because this is an obstetrics class, but that's not the case at all. And actually, the more abstract, the more open to meaning and interpretation it is for the students. And then at the end of the conversation about a work of art, communal understanding is reached through shared observations. And what we see is that students start to scaffold on each other and what each other sees. A student will say, well, I never thought about that. It didn't even occur to me that that might be what's going on. But since you said that, I could see this, this, and this. And they do tend to build on each other's comments. The other thing about this process is it allows students to encode visual evidence into words, and then they communicate more effectively with each other, and they learn in the healthcare profession that we need to articulate what we mean to other professionals, and this can help decrease hospital error. Developing visual literacy skills can help learners to communicate more effectively. This visual thinking strategies experience involves medical and nursing students who meet at the Art Museum. There's no hierarchy, no lab codes or name tags are required. Students feel safe and equal, and they're on neutral territory. All opinions are valued and equally considered. These 3 questions guide the visual thinking strategies technique. The first question, what's going on in this picture, is asked when students first approach a work of art. The student needs to provide visual evidence for what they are seeing. The art provides a starting point and allows the student to tell a story and personalize an experience. There are no barriers. Students come to the experience. Paraphrasing, active listening are used by the facilitator to assure that the student is understood and heard correctly, and it also provides an opportunity for the student to clarify in case the facilitator misunderstood what they said. This gives students a sense of being valued and heard, and they often say they don't feel that way in nursing school. They aren't given that opportunity very much. The second question that the facilitator asks is, what do you see that makes you say that? This question clarifies and asks for evidential reasoning from the student. The students need to continue to give visual evidence for what they are seeing and describe it to the group. And then the final question, what more can you find, is asked at the end of the conversation. This moves the discussion forward and asks students to look in a non-threatening way again at the painting. And often there are moments of silence after they ask this question, what more can you find? Students often feel uncomfortable with that silence, but it does make them go up and look at the painting again and see if there's anything they missed or anything that they might reconsider, and then it opens up a whole new conversation for students. So these are the 3 questions that guide visual thinking strategies. The National League for Nurses and the American Association of Colleges of Nursing have emphasized the need for liberal education and use of arts and humanities for foundation as a profession. In their 2010 book, Educating Nurses, A Call for Radical Transformation, Pat Banner, Molly Sipfin, Victoria Leonard, and Lisa Day call for nurse educators to provide students with innovative educational opportunities that incorporate creativity and imagination, that enhance personal growth and broaden their range of experiences. Visual thinking strategies not only provides this educational opportunity, but it also provides students a chance to work with other disciplines in a safe, neutral territory and enhances their ability to communicate. This visual thinking strategies assignment is given as an option for a homework assignment in the course. Students love it, and usually when I put the sign-up sheet for it, it fills up within 5 minutes, and I usually have more students than I do slots to go to the art museum. The students have a myriad of responses, and they really respond with enthusiasm. They appreciate the opportunity to get outside of the School of Nursing, to go to the art museum, and to work with medical students. So the next several slides, I will read some of the responses that we've gotten from students about their visual thinking strategies experience. I really found this experience helpful. I especially found the silence aspect enlightening. I know from class that silence is important, but it's still hard just standing waiting for someone to answer. The VTS facilitator used silence effectively and gave an example of when she interjects to move things along and when it is best to just wait. I see VTS used in nursing in a variety of ways. In my experience, I haven't really been given the opportunity to describe what I see. We do, however, ask people to describe what they think or feel in other ways so that we can understand them. This is especially true with subjective feelings such as pain or internal sensations. We as nurses cannot treat feelings that cannot be articulated. Doing so could endanger the lives of our patients or mask signs and symptoms that may help with their diagnosis. I believe this exercise is very valuable because it gives me practice in describing what I see and in working with other professionals. It also helps with my ability to work with patients and understand what they mean. Without this experience, I would not have known about how to build my critical thinking ability and my ability to describe. And to sum up, a final student response to VTS was as follows. To me, it seems like much of nursing requires visual thinking. We look at pictures to better understand systems and mechanisms in the body. We use pictures to evaluate things like broken bones and coronary arteries. I think using different methods to educate, regardless of the population, medical students, nursing students, patients, or the general public, helps people learn. It seems like more often than not we use words on PowerPoints and in books and in brochures. I love words, but I also love pictures, and I don't often get a chance to describe what I'm seeing. I like to read, but I also like to look and describe this. I don't feel like I often have the chance to describe what I see in school. In addition, the exercises we completed together were not pressured. It was easy to participate because I wasn't worried I'd be mocked or corrected or embarrassed. Again, it was collaborative. Everyone's point of view was respected and heard, and we garnered lots of good information by sharing our insights." End quote. So in summation about visual thinking strategies, this is a teaching method that's used to foster critical thinking and enhance communications among different disciplines in the healthcare system. We used it in an example with medical and nursing students. This experience can be done with disciplines other than nursing, and it helps to decrease anxiety in students when working with other disciplines and enhance their ability to correctly communicate what they're seeing. Hopefully, visual thinking strategies experiences will increase their descriptive abilities and help enhance their communications with other healthcare teams, and in turn will help provide a safer outcome for patients when they're in the hospital. Thank you for listening.